The LacriCATH balloon catheters pass through the superior punctum into the nasolacrimal duct down to the nasal floor. Distal positioning is verified through metal-to-metal touch or visualization. Withdraw catheter slightly so balloon is positioned in the lower duct and through the valve of Hasner. A balloon catheter inflation device is primed to the fill range with sterile saline, connected to the balloon catheter and used to inflate the balloon to 8 atmospheres for 90 seconds. The balloon is then deflated by releasing the lock mechanism on the inflation device and lowering pressure to 0 atmospheres. The inflation procedure is repeated a second time at 8 atmospheres for 60 seconds. The balloon is deflated, pulled proximally, and positioned within the lacrimal sac and nasolacrimal duct junction. The procedure is then repeated by inflating the balloon to 8 atmospheres for 90 seconds. A connector for bilateral balloon procedures is provided if both eyes are obstructed to allow simultaneous inflation, reducing operating time and anesthesia. The balloon is then deflated by releasing the lock mechanism on the inflation device and lowering pressure to 0 atmospheres. The inflation procedure is repeated a second time at 8 atmospheres for 60 seconds. Finally, the balloon is fully deflated by releasing the locking lever on the inflation device and the handle is pulled to draw a vacuum. The catheter is rotated clockwise to minimize the profile of the deflated balloon, and the catheter is gently withdrawn from the lacrimal system. Doctors using the LacriCATH products discover they are easy to use and provide a cost-effective way to treat epiphora in both pediatric and adult patients. Visit questmedical.com to learn more about the advancement in the treatment of chronic tearing.